Good evening. This is Carnivore Ken, and I just want to talk about cardio calcium scores. Cardio calcium scores, all right? I know if you had a high score, you might be a little concerned about it, as I am also. I would also like to say right off the bat, I am not a doctor. I'm just a guy from YouTube that's done some research, and this is my journey, and I don't recommend anybody, listening to me or, as far as what to do. As like everybody usually says, ask your doctor and follow his advice. Well, let's get on with my story. And by the way, if you ask your doctor and you follow his advice and you got high LDL, you know what he's going to tell you. Most likely go on a statin lowering drug. Anyways, I will just quickly tell you a quick little review just to round everything off about my eating habits, because that is important here. Over my whole life, I have been basically eating, once I reached adulthood, whatever I ate as a child before 20, but from 20 to about 56 or whatever, maybe a few years low. Most of the time I was eating low fat, because I was eating like everybody else, like they told us to eat. Saturated fats are bad, so I was eating low fat my whole life, eating fruits, vegetables, seeds, chicken breasts, fish, limited red meat, because that's what we were told throughout the decades, that was the way you were supposed to eat, and that's what I did. Okay, over the last 6 years, I switched. I had a change of heart, and I got tired of the same old results. I was even at one point vegetarian for a couple months. I've tried. The only thing I haven't really tried, I haven't tried being a vegan, but I did do a vegetarian diet for about 60 days, and it was something that I did not really enjoy, and I just didn't stick to. But anyways, the last 6 years, I've been low carb, high fat. For 4 of that last 6 years, I was keto. The last 2 years of that 6, I've been carnivore, rather strict on carnivore. I have recently added sauerkraut, just 2 tablespoons a day, not much, but just 2 as a garnish, usually with my meat. And once in a while, I eat a few berries just for a little flavor in my mouth, I guess you could sort of speak, making sure maybe I'm getting, the proper nutrition if I am missing anything. But I don't think I am. I think the carnivore diet is the proper human diet, okay? But anyways, let's go back to my story. So now you know the way I've been eating. Low fat, salads, nuts, all that healthy stuff for the majority of my last 40 years, other than the last 6 years, okay? I moved from Michigan to Georgia. When I got down here, I went in and had a physical. And I have always had high cholesterol throughout my whole lifetime. I would go in, high cholesterol, get back on the rabbit food real strict, lower it. They always say, okay, you're good, the ratios are good, you don't need to go on a statin drug. And I've done that my whole life. Came down here, I decided that I haven't been back to the doctor for several years, decided to go have a physical. This was in 2020, went and had a physical, and that was a few years after I was currently on the keto diet at the time. I didn't switch to carnivore till January 2022. That's why I'm not quite 2 years, but 2 years is coming up in a few months, just a few short months. That I've been on carnivore. Once again, kind of rounding numbers off. But anyways, I was keto at the time of that physical. My cholesterol was elevated. So this video is just to address the calcium score, what information information I have to share for that, because I'm sure there's a lot of you out there that probably have a calcium score other than 0. All right. So anyways, after the high cholesterol at my physical in 2020, my doctor, of course, prescribed a big old horse pill, Crestor pill, and baby aspirin. Okay, then set up a calcium score. I went ahead my calcium score, and of course I was hoping for 0, but it didn't come up 0. In fact, it came up a large 1,144, which is really off the charts. I had the only artery that I didn't really have any calcium in was the left main, but the right coronary, the left anterior descending, the left circumflex all had calcium. So total was 1144. I covered that in my last video about where it was directly at. So anyways, now you know I have high calcium. And I did find this here, which I showed everybody in the last video, because I am over 1,000, points plus on the calcium score. It says I'm at a 25% chance of a heart attack within a year. So now we know that. All right. Now, what I think happened, because I always was watching my diet for 40 years. The supposedly healthy, low-fat, vegetable fruit diet. I also exercised that whole 40 years, and I did a lot of chronic cardio. I usually would run every other day. I did resistance training. I've always worked out consistently since age 24, and now next month in November I'll be 64. All right. Through a lot of my research, I found out that a lot of ultra marathoners have high CAC scores, and they think that maybe this is because of all the added blood flow through their arteries, because of all the endurance work that they were doing. And I have seen a panel of doctors talking about these ultra marathoners, and they're not really sure if it's a risk factor or not. Remember, everything we're talking about, everybody has a different point of view. I'm not a doctor. We're not going to talk a bunch of studies. I would generalize studies that I heard about. But keep in mind, I ran almost every other day. I've done marathons, half marathons, high-tech races. When I'm not doing those, I was running 5 to 10 miles every other day normally, and because I thought it was good for me. Maybe it wasn't good for me, all right? So I will address what I'm doing now in a minute, but back to the ultra marathoners. This is an article that I saw pertaining to ultra marathoners. It was from the Outside article magazine. I don't know if you heard of that or not, but I thought I'd reference it. It says the good news is that endurance athletes, which I certainly probably was an endurance athlete with some mixed in resistance training, tend to have different plaques compared to non-athletes. I would certainly consider myself an athlete because I've, 40 years of sticking with it. The athletes, plus I did it at work. I worked at a boot camp, and I did PT, physical training, almost every day at the boot camp, Monday through Friday. But let's get into what this says here. The athletes have plaques that are smooth, hard, and unlikely to rupture. The non-athletes have softer plaques that are more likely to break off from the arterial wall and block the flow above. So there is a theoretical, hard to spit out, argument that high CAC scores shouldn't be considered as much of a problem in athletes as they are in others. But no one has demonstrated that this is how it pans out in the real world. Now, mind you, ultramarathoners, normally, people at that elite level, are eating what people consider healthy diets. All right? Low fat, fish, chicken, rice, potatoes, carbs for energy for running, fruits and vegetables. All right. And that is what I have to say about that. All right. Now, the calcium score test, which if you're here, you watching this video, maybe you have one, shows calcification happening in the coronary arteries that have plaque buildup. Well, let's address that, okay? I had a calcium score high, 1144, and after that I had a couple tests done. I had a CTA, which they injected dye into my arteries to see if I had any blockages, and that came up negative, and no blockages. And I also did a stress test, which because I do a lot of cardio work, it took forever incline for my heart rate to get up high. All right. Anyways, I did have the CTA test and a stress test following, and that would show if I had any blockages. My cardiologist said that he felt my calcium buildup in my arteries was from the outside in. He said I killed it. Congratulations, you did great. On the CTA and the stress test. All right. There's one test that would have been nice to have. That is called the CT, coronary angiography. This test actually detects both calcium deposits and soft plaques, and it's called a CT test basically. That would have showed both the soft plaque and the hard plaque. Now it's important that you will hear across the board that it's the soft plaque, soft hot plaque that ruptures and causes your heart attacks and strokes. The calcified stable plaque isn't the problem unless it ruptures. Soft plaque comes shooting through, I assume. Okay, and even if you have a CAC score of 0, you might have soft plaque. You don't know. So I mean, none of this is 100%, but we know that having 1144, you definitely had something going on, some issues. I'm not 0. So anyways, I found some more. And I got this from JAMA, the Journal of the American Medical Association. This is a study of 189 patients and 189 controls. And it's a recent study. It's 2020, so fairly recent. All right, basically they did a study of patients that had at least 1K plaque in their arteries. They followed these individuals for 2.5 years, and 1K plaque means 1,000 or more. Everybody knows that. 1K individuals had less low density plaque, and it says patients who suffered heart attacks had less than 1K plaque, less stable plaque. So what this study was suggesting, from what I could interpret from it, was that I'm 1144, once you got over 1K, possibly a lot of your soft plaque has calcified. And, people just assume having a higher calcium score puts you at a higher risk. But this suggests that possibly having a higher calcium score past 1,000K means that these plaques are calcified to the point that they actually present a less risk to you. All right. Like I said, this is all guessing though. None of this is for sure. But I'm concerned because I do have high calcium score. So of course I am doing a lot of research on it. And if you're concerned, I hope you like and follow, and I will present the information as I get it to people that have similar problems as myself. Now, anyways, there's a Dr. William Davis, and I was watching one of his videos about calcium scores, And he basically said, and I confirmed this through my cardiologist, because after I went to the doctor, my general practitioner that started me on the statin, I had a calcium test, I had to go see the cardiologist, and when I was in there, once I was there, they have a lot more time to talk to you. I, of course, am still wondering about this Crestor my doctor wanted to start me on, 20 milligrams, which is pretty high. My cardiologist thought that was way too high too. He decided to lower it to 5 milligrams. And I presented him with the fact that what I heard on the internet, of course, and supposedly backed by studies, that if I don't change anything and I start a statin as the thing that's going to fix me, I can still expect a 25% raise in my calcium score per year. And he said, my cardiologist said, that is in fact a true statistic. All right. If I don't take the statin drug and just go on as normal, what can I expect? A 25% increase in my calcium score each year on average. So with the statin drug, 25% increase. Without the statin drug, a 25% increase. So either or, that didn't sound good to me. And I know a lot of people out there take statin drugs. So this video really isn't about statin drugs. But now I'm going to tell you what I'm doing to fix the problem. The majority of my life, I was on a low-fat, high-grain vegetables, fruits, nuts, and all that. Your calcium score doesn't build up just in a few short years. It builds up over your lifetime. So most likely the last, since this test was done in 2020, I had only been doing low fat, high fat, low carb for about 3 years at that point. So it's highly unlikely those 3 years build up the calcium score. It's probably already happening. Okay. Anyways, I'm not for statin drugs. I know there's a bunch of opinions out there, but I don't see the benefit of using a statin drug, especially when I use that statin drug and I'm still going to have a 25% increase. It may calcify soft plaque, granted, but I think I already calcified my soft plaque. Remember, I'm on the 1K plus team here, all right? I think I've already made the changes by having the proper human diet and lowering all my inflammation in my body, that hopefully that's going to help with my overall mortality. I don't see the benefit of a statin drug, all right? There's a lot of different people out there you can research and look at the doctors with all the studies. I know a lot of people probably know about David Diamond. Some of you out there from the comments don't think he knows his stuff, but I mean, he sounds like there's more than just David Diamond. But one thing that he really brings up as far as statin use is relative risk versus actual risk. I don't believe there's much benefits to statin use. If you go into your doctor, according to David's research, and you are put on a statin drug, or let's say you refuse a statin drug, in that next year, you have about a 1% chance of having a heart attack or a stroke if you have high cholesterol, 1% chance. Let's say you went to the doctor and this is the difference between relative versus absolute, okay? Let's go, you went to the doctor and you start the statin drug, all right? You have approximately 0.6% chance of having a heart attack or a stroke that first year. So anyways, without statin, you have about 1% chance. With the statin, you have about 0.6%. Now, the pharmaceutical companies come along and they will tell you the relative risk is, hey, your chances of having a heart attack or a stroke are reduced by 40% because it went from 0.1 down to 0.6. But as you see, what I'm trying to tell you is that relative risk is how they distort the benefits of statin drugs, okay? Keep in mind with statin drugs, there's all kinds of side effects that they try to underplay, and such as lower testosterone, different types of cancers, liver cancer is a big one, breast cancer in women, dementia, increased chances of type 2 diabetes. The list is long, all right? Dr. Paul Mason is another person out there that put out a video. You can go ahead and check it out on YouTube, The Truth About Statins. And he will go over how statins were created. And like I said, I want to do a deep dive into statins here. But you have to understand that high CAC score, they're going to want to give you a statin. In reality, statins, if they do anything, they'll raise your CAC scores. They're not going to bring it down. And they could do damage, all right? There's a Dr. Nader Ali. He was a cardiologist, and he has a lot of different views on statin use. And like I said, I want to pertain this to just the CAC. I'll do a future cholesterol video. He had patients in their 90s that, women in their 90s that had a high LDL their whole life. And guess what they didn't have? They had 0 calcium scores. So that suggests there's more to the story, and they weren't on statin drugs. That suggests there's more to the story than just the LDL, all right? And that's what I believe too. I believe there's a whole lot more to the story than LDL. Dr. Nader Ali is a cardiologist. He practiced cardiology for years, done stints, numerous patients, and he prescribed statin drugs. But he found, through the years, he found people that his patients that were on statin drugs, but their heart disease did not improve. In fact, it got worse. So that made him do a deep dive, and he finally came up with basically low carb, high fat. That is what his regimen is. And he also has videos out there, and he will list why he's not a big statin supporter either, across the board, or the PCSK9 inhibitors that can drop your LDL basically down to 0. And he's not big on that either. And he has a lot of studies that he talks about in his video. If you just go look up the truth about, not truth about statins, but look up Dr. Nader Ali and about longevity and people with higher cholesterol that actually live longer. And he has, he's put people on low carb, high fat diets, and all their markers improved. Their triglycerides went down, their HDL went up, their blood pressure went down, their glucose levels improved, their metabolic syndrome improved, type 2 diabetes people became non-diabetic, a vast, just an array of beneficial things that happened. That their LDL went up. So we have to ponder if in the case of a low carber, high fat low carb, is LDL going up a huge risk factor? I think not. And most of the low carb doctors believe that too. The bottom line, if you're going to eat carnivore like I do, and you're afraid of high LDL, you probably shouldn't eat carnivore, because there's a good chance you're going to fix your type 2 diabetes or your metabolic syndrome, but you're probably going to have 3 common markers: high LDL, low triglycerides, high HDL. All right. There's also Dr. Philip Ovadia out there, cardiologist. You know, he's also a low carber, high fat person. The proper human diet, when we're talking eat all meat, there's Dr. Barry on the YouTube, Dr. Shafee, been eating all meat for years, Dr. Baker, eating all meat for years. All these folks have been doing good for years. And of course, one of my favorite doctors is Dr. Sean O'Mara. So what am I doing? I got 1144. Am I concerned? I'm going to have another CAC test. I just had a physical, and that really having repeat CAC tests is the only way for low carbers that have 0 scores. You have to have them redone in the future just to see if that is in fact the low carb keeping you at 0, or maybe you were going to have no zero calcium score regardless. For a guy like me that had a calcium score after 40 years of almost 40 years of eating low fat vegetables, fruits, and all that, chicken breasts and fish, we don't know when my problem started, but we know it most likely started when I was eating what they tell you to eat on the food pyramid, right? For myself, having another calcium score might show that I've reduced my risk because the typical race, remember, is going up 25% a year. Maybe mine has plateaued, or maybe if I'm lucky, it has dropped. But most people, well, Dr. William Davis actually says that you can drop your calcium scores by basically eating low carb and eating fermented vegetables and working on your microbiome. I don't know if that's true, but I did see a couple, that's what he says, it very well could be true. I did see a couple carnivores on videos that talked about their scores dropping several hundred points. So I'm hoping for a lower score, or at least maybe a more leveling out score. But we'll see it. When I get my next calcium score, I will make a video about it. What is my plans? And what have I been doing? I've been following what Dr. Sean O'Mara suggests, most of that recently. He is he was an ER doctor. Now he's just into health optimization. And he is now a 60-year-old man. If you were to see him when he was 48, living the normal doctor life, normal standard American diet, versus now, after years of following his routine, he looks way better at age 60 than he did at 48. Okay, his whole thing is carnivore type of diet, but you also eat fermented vegetables because that's for your microbiome. And he's into remember, I was chronic state cardio before, doing all that long distance running. He is against long distance running. He is into sprinting. His whole thing is the number one cause of all diseases is visceral fat. That causes most of your problems with cancers, heart attacks, strokes, the whole kit and caboodle. That is what you should really be addressing. And I kind of think he has a good point there. You know, if you have a big old gut, you can kind of figure you probably have a fatty liver. You have all this fat around your organs, and you're secreting all these nasty things throughout your body that's going to affect your health, okay? So anyways, he doesn't believe in chronic cardio, long distance running. He likes sprinting, and he likes eating fermented vegetables and mainly a meat-based diet. All right, for fermented fruits too. Also, he's into cold plunges and saunas and all that. Now, I've been following, I just recently started eating fermented sauerkraut, a couple tablespoons a day, because I've been carnivore the last 2 years. I've been feeling great. I did switch to his sprinting routine about 6 months ago. I gave up long distance running and nothing else. Okay, nothing else. I was just carnivore, gave up the long distance running, started sprinting 3 times a week, doing 10 100-yard dashes. The first 25 yards is just to warm up, then you hold it for 75 yards. So it really is a 75-yard dash. You rest in between till you get your breath back, calm down, and then you do your next one. We do that 3 times a week for 10 sprints, and then after that we go in and do a leg workout normally on sprint days. All right, I've been doing that. That's the only thing I changed from my previous routine. Now, what happened to me after 6 months of doing his routine? I still had a gut at the time, and I don't mind, I lost most of my gut, and now I'm just left with skin over the muscle. Skin takes a long time to snap back, especially when you're in your 60s. So if you have a lot of a big belly, but excess skin isn't really a health problem. I mean, you can always, if you're really concerned about it, you can get that excess skin removed through, with surgery if that's a big concern. I'm not that concerned. I think I found my way of attacking my health problems through a low carb diet. I have added the fermented sauerkraut again because I know sauerkraut is very high in K2. K2 helps divert calcium away from the soft tissues of the body and helps it enter the bones. So maybe that will help my situation, But what I'm doing is following pretty much what Dr. Sean O'Mara says to do. And I found a big reduction in my visceral fat. Now, I haven't had a Deca test, and he does ultrasound, so you can actually see or MRIs, so you can actually have a picture of your visceral fat. And he's located up in Minnesota if you're interested in going up there and seeing how much visceral fat you have. But I've basically instituted most of his stuff the last 6 months. Okay, I've even started, I've done several cold plunges now, but that's what I'm going to do. I'm not going to take statin drug. I am going to continue on with the carnivore diet because I mean, it's pretty hard for somebody to tell me to do something different when this is the best I've ever felt my whole life. And, plantar fasciitis went away. All the arthritis went away. I'm never bloated. I mean, I'm doing this video in the evening. Before, when I was eating even keto, and definitely when I was eating low fat and salads and all that, I was always bloated at night. Now I'm never bloated. When I used to eat beans, now I wasn't only bloated. I get a lot of gas. You know where that comes out. So that doesn't happen once you go carnivore. Most you usually don't even pass gas, to be honest with you. Once you get past that initial phase where your body's adapting to it, you feel great most of the time. All right. Dr. Sean O'Mara, he does a lot of 3-day fasts. I do a lot of fasting, but I find with the carnivore diet, it's a little harder. I get hungry sometimes. I can usually go about 1 day. I've only done a 3-day fast, and maybe it's just a mental thing. But at the same time, I'm trying to maintain my muscle. I've lost my belly over the last 6 months, but I maintained my muscle. In fact, my bench recently has went up a little bit. At the gym, I mean, I'm not a super big guy. I'm weighing around 171, and I'm 45-pound bar. Nobody touches it. And the other day, I was able to, at the age of 63, I pushed it 5 times without the spotter ever touching the bar, which is good for me. All right. Anyways, like I said, none of this is medical advice. I just know it's alarming for a lot of you to have a high CAT score. This is what I'm doing. I'm hoping that it's going to benefit me in the long haul. I'm not taking a statin drug. Uh, Statin drugs scare me. Lower your testosterone. I mean, having high testosterone after the age of 60, is important for a lot of things, especially if you're still enjoying an active romantic life with your wife or your significant other. So I'm not going to take a statin drug. Pretty much the videos I've seen scared me away. I don't see the benefit in them. I see this. I think the pharmaceutical companies way outdo the benefits. And the whole point is, even my cardiologist said I can expect a 25% increase even if I'm on a statin. So with my level of calcium, I don't see what the point is. I would rather have, since I have done my life behavior changes, that I think that should be enough. And I'm hoping. We're all hoping, right? We all know we're going to die from something someday. That's inevitable. With my score, which it says the calcium score of 0, but I'm higher. What did it say here? So it's okay. Calcium score of 400 indicates extensive arteriosclerosis plaque burden, high likelihood, 89% of at least one significant coronary stenosis, and high implication of cardiovascular. It is recommended to institute very aggressive risk factor modification. Consider exercise, which obviously I've been exercising for the last 40 years, or pharmacological stress imaging to evaluate, which I did have all this stress, so imaging. But it doesn't say to have a statin drug there, but that's what your doctor's going to recommend. And here we go. This is something else I wanted. One last thing about statin drugs before I didn't mean this to be a statin drug video, but I got this off of Crestor.com. All right, and this the one thing that caught my eye is I'm close to 65. Okay, I'll be 64 in November of 2023. Anyways, this is about Crestor. Counterdictions: acute liver failure, decompensated cirrhosis, hypersensitivity to rosuvastatin, which is Crestor, or any excipients in Crestor 4. Okay, warnings and precautions. This is what I wanted to talks about myopathy and down. Here, see if you can pronounce that. Rhabdosis. Risk factors include age 65 or greater, uncontrolled hypothyroidism, renal impairment, concomitant used with certain other drugs, and higher Crestor dosage. Asian patients may be higher risk of myopathy. That's the muscle breakdown and the pain. Okay. Discontinue Crestor if marked elevated CK levels occur or myopathy is diagnosed or suspected. Temporary discontinue Crestor in patients experience an acute or serious condition at high risk of developing renal failure secondary to rhabdosis. Inform patients of the risk of myopathy and that fancy word, rhabdosis, when starting or increasing Crestor doses. Instruct patients to promptly report unexplained muscle pain, tenderness, or weakness, particularly if accompanied by malaise or fever. Yep, that's what it says right here. Rare reports of IMNN, immune-medicated necrotizing myopathy, and autoimmune myopathy has been reported with statin use. Discontinue Crestor if IMNN is suspected. Hepatic dysfunction increases the serum transaminases have occurred, some persistence, rare reports of fatal and non-fatal hepatic failure has occurred. Consider testing liver enzymes before initiating therapy as clinically indicated thereafter. If seriously hepatic injury and clinical symptoms and or hyperbilirubinemia or jaundice occurs promptly, discontinue Crestor. I mean, Crestor.com. You can look it up for yourself. Bottom line is, this is how I'm approaching my high calcium score. I don't see the point of going on statins since my score by there's cardiologist, it's going to go up 25% regardless. I think if I eat the proper human diet, my chances are a lot better. You know, also not doing all those bad things like, you know, you shouldn't be drinking, shouldn't be smoking, shouldn't be doing none of that. I rambled on here, and I just would appreciate a like and follow. And when I get my next, I assume that next calcium scores test is coming pretty soon. My last one was in July 13th of 2020. And remember the last 2 years, almost the last 2 years, 22 months I've been carnivore. So it should be interesting. All right, everybody have a good evening, and go out and do your best, and don't ever give up. That's the main thing. Have a positive attitude. You know, for some reason I'm not scared. Maybe I should be, but I don't think being scared would help me. All right, have a good day. Carnivore Ken out.